9 side effects of ginger you must know about. This spice may be common in every household, but the knowledge of the downside of consuming it is not. A few side effects of ginger may cause you to think twice before adding it to your diet. Ayurvedic practitioners have been using ginger, Zingiber officinale, to treat many conditions for centuries. Unfortunately, this herbal medicine has some detrimental effects as well. Excess intake of ginger can cause heart issues, diarrhea, and increase the chances of miscarriage. In addition, people taking medicine for high blood pressure may wish to limit their consumption of ginger as it may interact with drugs and further lower blood pressure. This video examines the side effects of ginger, its safety, recommended dosage, and any potential drug interactions. Watch on. Know the flip side, ginger. Short-term effects are heartburn, upset stomach, and diarrhea. Long-term effects may lead to miscarriage and may excessively lower blood sugar levels. Drug interactions. It may interact with blood thinners, immunosuppressant drugs, and anti-diabetic medications. When to see a doctor. If you experience mouth irritation such as a tingling sensation or swelling, then consult a doctor immediately. Uses of ginger. Ginger has a rich history in traditional medicine and culinary science. It not only adds a delightful zing to your diet but also boasts of a range of health benefits. One of the primary benefits of ginger lies in its ability to soothe digestive and abdominal discomforts, such as nausea, indigestion, and motion sickness. 2. It is also revered for its anti-inflammatory properties. Individuals often use it as a natural remedy for pain relief, particularly in the case of arthritis. 3. Furthermore, ginger has immune-boosting qualities that can help fend off common colds and flu. 4. However, excessive use of ginger can also result in some side effects. Key takeaways are: ginger may cause heartburn and digestive distress in some people with excess consumption. Sometimes, excess intake may cause allergic reactions in some people, which may lead to skin inflammation and rashes. Hence, consult with your doctor regarding dosages and exceed the recommended dosage to avoid side effects. 9 side effects of ginger. 1. May cause heartburn. Ginger, when taken in higher doses, more than 4 grams per day, may cause mild heartburn. Other likely side effects of ginger include stomach discomfort, belching, acid reflux, and diarrhea. In case you are using ginger as an alternative remedy and are experiencing heartburn as a side effect, you may want to try ginger in capsule form. Anecdotal evidence suggests this may have minimal side effects. However, an American study reports heartburn in subjects who were given capsules of ginger powder dried in dark conditions at room temperature. Most often, consuming more than 5 grams of ginger per day may lead to side effects, such as heartburn, abdominal discomfort, and diarrhea. To avoid these issues, it is best to limit your intake to under 4 grams per day or stop using ginger altogether if symptoms persist. Quick tip: have alkaline foods like bananas and melons along with foods rich in water, like watermelon, to soothe your heartburn. 2. May cause bleeding. Ginger may aggravate bleeding issues. This applies not only to the herb, but also to any ingredient present in the herb. Certain experts believe that ginger could cause bleeding due to its antiplatelet, blood-thinning properties. This means that ginger may interfere with the normal clotting process, making it harder for blood to form clots, potentially increasing the risk of bleeding. Hence, people who take antiplatelet medications should consume ginger with caution to avoid an increased risk of bleeding. Research further suggests that ginger may increase the anticoagulant effect of warfarin, a medication commonly used to prevent blood clots. This means that consuming ginger while taking warfarin may lead to excessive bleeding, as both work to thin the blood. Some also believe ginger can further increase the risk of bleeding when taken along with other herbs like cloves, garlic, ginseng, and red clover. However, more research is warranted in this aspect. 3. May lead to diarrhea. If taken in large quantities, ginger can cause diarrhea. Gingerols, the active ingredients in ginger, speed up the passage of food through the intestines and may cause. While this was confirmed in animal studies, more studies in humans are warranted. Another study found that taking ginger powder in moderation helped the stomach work faster by improving its contractions and speeding up how quickly it empties. Ginger may also help food move through the digestive system more quickly by interacting with serotonin receptors in the intestines, playing a role in gut movement. While this may be beneficial for relieving constipation or indigestion, excessive consumption may disrupt normal bowel patterns, leading to diarrhea. Diarrhea can occur when the stool moves too rapidly through the gastrointestinal tract. Abnormal gastrointestinal motility and excessive fluid secretion of the gastrointestinal tract cause diarrhea. 4. May upset stomach. There is less research in this regard. Ginger stimulates the secretion of bile, which benefits digestion. But if your stomach is empty, this may lead to excess gastric stimulation, causing digestive distress and an upset stomach. Also, high concentrations of bile have been linked to diarrhea. The gingerol in ginger, which is similar to capsaicin, the active ingredient in many spices and chili peppers, is thought to irritate the stomach. This may leave you feeling unsettled. In fact, a review of 5 studies conducted on 593 patients to check for ginger's efficacy in the treatment of osteoarthritis found an astonishing result. It was found that the participants who were given ginger were 2.33 times more likely to discontinue treatment than the ones who were given placebo despite experiencing pain reduction. This is because they experienced various forms of stomach upset or simply did not like the taste of ginger. However, some evidence states that ginger could actually help treat an upset stomach. Hence, more studies are needed to understand how ginger may cause stomach upset. 5. Might not be safe during pregnancy. Though ginger can reduce nausea in pregnant women, it is important to note the herb's dark side as well. According to certain experts, consuming ginger can increase the risk of miscarriage. It may not be dangerous if the dosage is below 1,500 mg per day. Anything beyond this could be unsafe for pregnant women. Taking ginger supplements in large doses can also cause miscarriage and other complications. Though ginger is safe when used in amounts found in food, it can cause problems during pregnancy. Excess intake of ginger during pregnancy may also lead to acid reflux and heartburn. Ginger can increase the bleeding risk by decreasing the aggregation of platelets due to its antiplatelet, blood thinning properties. Hence, mothers who have lost a significant amount of blood during childbirth must abstain from ginger during the early days following childbirth. 6. May cause gas and bloating. Ginger tea may cause certain mild digestive side effects. It most often impacts the upper digestive system and causes upper digestive gas, discomfort, and problems like acid reflux. Anecdotal evidence suggests that replacing ginger with supplements could be one solution to this. But make sure you talk to your doctor before using them. According to the National Center for Complementary and Integrative Health, ginger may cause gas and abdominal discomfort, especially if taken in large doses. Some believe the same could happen with ginger ale, the carbonated drink. The drink may aggravate bloating in certain individuals. Research suggests that carbonated drinks could worsen acid reflux. It also suggested this may cause a feeling of discomfort in your stomach, but this typically happens only if you drink more than 300 milliliters at once. However, more research is needed to strongly support these claims. 7. May lower blood sugar way too much. Ginger is usually known to aid diabetes treatment by lowering blood sugar levels. However, taking it along with diabetes medication may cause problems. Ginger may enhance the effect of the medication and cause hypoglycemia, a condition that leads to excessive low blood sugar levels. 8. May cause mouth irritation. This is also called oral allergy syndrome. Certain allergies occur when you consume certain foods. The symptoms are generally specific to the ears, skin, and mouth. One such allergy occurs when you consume ginger, not in all individuals, though, where your mouth starts to itch. Mouth irritation might also lead to an unpleasant taste. Though switching to a ginger supplement might help, this is not always the case. Other related allergies include tingling and swelling of the mouth. However, limited research is available in this aspect, and we need further studies to understand why ginger may cause these allergies. 9. May cause skin and eye irritation. According to an Iranian study, the most common allergic reaction to ginger is a skin rash. Other allergies to ginger include itchy eyes, skin redness, and skin inflammation. However, more studies are needed to properly check the cause behind these side effects. These are the major side effects of ginger. But there are certain other ill effects of ginger, or of the different forms of ginger, that you need to be aware of. Side effects of eating ginger in other forms. Ginger root. Consuming ginger root in excess can cause stomach discomfort and a bad taste in the mouth. It might also cause nausea. Other potential side effects include allergic reactions, prolonged bleeding, heartburn, diarrhea, acid reflux, and arrhythmia, irregular heartbeat. Ginger root may also lower blood pressure and cause gallstone formation by increasing bile acid secretion. Turmeric ginger tea. Anecdotal evidence suggests that turmeric ginger tea may cause complications in individuals with a history of kidney stones or gallstones. The tea may aggravate the condition by increasing the levels of uric acid in the blood. It may also cause stomach cramping and bloating. However, there is less research in this regard. Hence, consult your doctor. Lemon ginger tea. Anecdotal evidence suggests that the only side effect of this tea is frequent urination. Excess consumption of lemon ginger tea, or any beverage for that matter, may cause frequent urination. Hence, limit the intake of this beverage. Ginger water. This is also known as ginger tea in certain regions. The side effects are similar to that of ginger, which include heartburn, stomachache, gas, and a burning sensation in the mouth. Another side effect of ginger water, the tea, is that it may disturb your sleep. This means that it can keep you up for a long time at night if you consume it before hitting the bed. However, limited information is available to support this point. A case study of a 43-year-old man suggests ginger tea may also cause urinary issues. Here is what you should know about it. 1. The man suffered from problems like a weak stream, pain, and discomfort for 4 years, along with chest heaviness and palpitations. Despite multiple medical visits and treatments with antibiotics, his symptoms persisted, and tests showed no abnormalities in his urinary system or other potential causes. After further investigation, it was revealed that he had been self-prescribing ginger tea for 15 years to treat knee pain. Upon stopping the ginger, his symptoms gradually improved, disappearing completely after 8 weeks, with no relapse during a 6-month follow-up, suggesting the ginger was the cause of his issues. Ginger ale. Is ginger ale good for you, or does it have any side effects? Though ginger ale contains ginger, it is a sweetened carbonated drink and, hence, comes with less benefits. The high levels of sugar may contribute to weight gain and increased risk of diabetes if consumed excessively. Further, carbonated drinks may lead to bloating and stomach discomfort if you drink more than 300 milliliters at once. Further, if you take blood pressure medications, blood thinners, or diabetes drugs, you should be cautious about the ginger content in the drink, as it may interact with certain medications. Ginger is also available in the form of capsules these days. But are they safe? Find out in the next section. Side effect of ginger capsules. The major problem with ginger supplements is their tendency to interact with prescription medications. Most of their side effects are similar to that of raw ginger. For most people, ginger is safe to eat raw when eaten in amounts typically used in food and recipes. Eating more than 5 grams of raw ginger or taking ginger supplements may increase your chances of digestive issues, such as heartburn, diarrhea, and an upset stomach. Ginger was found to have anti-diabetic properties. If taken along with anti-diabetes medications, ginger, or its capsules, can lower blood sugar levels way too much. Ginger has been closely related to turmeric, also called yellow ginger, for its therapeutic properties. However, turmeric too may have side effects if taken in excess amounts. Turmeric may interact with certain medications. These include cardiovascular drugs, antibiotics, anticoagulants, chemotherapy drugs, and antihistamines. Though research is limited to conclude the medical interactions of yellow ginger, it is important to exercise caution. Possible interactions. Stephanie says, ginger can interact with some medications, particularly blood thinners that slow blood clotting and some blood pressure medications. It may also interfere with diabetes medications that lower blood sugar, medications that suppress the immune system, and certain antibiotics. If you take any of these medications, speak with your doctor before adding ginger or ginger supplements to your diet. Ginger also interacts with other drugs like femprocommon, a drug used in Europe to slow blood clotting, and warfarin, another drug to slow down blood clotting. Consuming ginger along with these medications might increase your risk of bruising and bleeding. So, if you are wondering when not to take ginger, try avoiding it if you consume any of these medications. Recommended dosage. Dosages of around 1,500 mg per day were found to treat nausea. Going beyond this dosage may cause adverse effects, though information is unclear. Hence, it is important to consult a doctor. If it is ginger root, the following dosages may be ideal. These are just guidelines. For ideal values, please consult your doctor. For children between the ages of 2 and 6 years, not more than 2 mg of ginger root in a day. For adults, not more than 4 grams of ginger root in a day. For pregnant women, not more than 1 gram of ginger root in a day. If it is ginger tea, anecdotal evidence suggests adults should not consume more than 2 to 3 cups a day. The guidelines mentioned above also apply to ginger supplements. However, it is best to consult a doctor to determine the dosage and stick to it. Ginger was one of the first ingredients to be exported to Europe via the spice trade. It is native to the maritime Southeast Asia region and was first cultivated by the Austronesian people. While ginger can sometimes cause side effects, especially when consumed in large amounts, this should not stop you from consuming it. Instead, you can follow the simple tips mentioned in the next section to minimize the side effects of ginger. Tips to minimize the side effects of ginger. Here are a few simple tips that will help you minimize the side effects of ginger. If you are consuming ginger for the first time, gradually introduce it into your diet to see how your body responds. Start off by adding small amounts of ginger to your food. Check how your body reacts to it. If you notice any side effects, avoid using it. Do not consume more than 4 grams of ginger a day to avoid issues like heartburn, diarrhea, or bloating. Stick to moderate quantities, such as 1 to 2 grams per day, unless advised otherwise by a healthcare professional. If you are prone to allergies, be cautious when trying ginger for the first time. Keep an eye out for symptoms like rash, swelling, or difficulty breathing. Visit a doctor immediately if these occur. Also, stop consuming ginger altogether. You may try other herbs and spices like garlic, pepper, and cinnamon instead. If you are pregnant or on any medication, check with your doctor before increasing ginger consumption. When using ginger in cooking, balance it with other ingredients to reduce irritation in the digestive tract. Thanks for watching. Please, like, share, comment, and follow our channel for more updates.